Allied Health Professions. I'm a dean and professor in the counseling department. All departments are equal. I started out doing care here in the School of Allied Health this past April, and have been here in a warm, welcoming environment. Your students, your children, who are our students, come here each and every day, whether it's this building and or the other building across the street. Our school is divided because we're just big. There's not enough space. So this is one of our two buildings that we occupy on campus. That houses the counseling department and the physician assistant studies. And so before you go across the street, please feel free to visit those departments. And then for those of you who have children in this building, please feel free to walk across the street to visit the other departments.
As physician assistants in patient care includes seeing the patient very shortly after they arrive to the emergency room, the clinic, or any setting that they may present to. We take the history of the patient, we perform a physical exam, we interpret their vital signs, we order diagnostic testing, whether it be laboratory studies, imaging studies, or other diagnostic tests.
We provide laboratory testing system. Usual initial tests that are ordered on our patients would be like a CBC, which has us look at their blood, metabolic panel, urinalysis, coagulation studies. So for
respiratory therapist throughout the hospital is part of management, is part of critical care, transport teams. In this case here, this individual with potential stroke who want to go to ventilator. So you may find the respiratory therapist working with many of the other allied health professionals in order to maintain their pulmonary status and managing the ventilator in this acute setting.
Cardiovascular sonography, so if you look at that term, cardio for heart, vascular for blood vessels. So you should be thinking non-invasive imaging, which is going to be ultrasound. So our question we're trying to answer is, what caused the stroke?
Rebecca Ford, I'm from the occupational therapy department. So this is the first kind of rehabilitative field that we're going to talk about today. So we actually joined the patient's team pretty early on. So in the acute care setting, sometimes this patient is still in at the ICU. Our ultimate goal is to help get this patient back to doing everyday activities, and specifically activities that are meaningful to this patient.
I'm a senior counselor of physical therapy. Excuse my teaching, sorry, Pete. The role of a physical therapist in this case is essentially to assess how the patient's moving, if they're having any pain, and how we can help their breathing function. So we'll do strength testing, we'll do balance testing, especially with the stroke, we'll test their sensation, and then we'll do really good gait analysis.
I'm Celeste Aguilera. I'm a speech language pathologist. Speech pathologists or speech therapists treat a wide variety of things. In the case of Mr. Boudreaux, he's coming in with stroke. We're going to take a look at a few things. Firstly, we want to take a look at his receptive and expressive language. Receptive would be what he's understanding. Is he comprehending simple directions? Is he understanding what we're saying to him? Or does he need additional support, visuals, prompts, and cues for him to understand what we're saying?
Cardiologists. We are people who diagnose, treat, and manage hearing balance disorders. So we would first do a hearing assessment, especially since he had a history of hearing loss, but also the stroke could have affected the blood flow to his hearing organ. Depending on what the stroke was in the brain, it could have affected the hearing center in the brain. So sometimes we could see an increase in hearing loss or mismatched or unilateral hearing loss.
Is going to round us out. We will be doing some mood and anxiety screeners with the client because we know that there's a high rate of anxiety and depression as a comorbidity with stroke. We look at a depression screener specifically, which does have one item that can alert us if there's any concern about suicide, and then we have another risk assessment to look more closely at suicide if that's a concern. We would provide counseling to the individual, to the family, maybe couples, and our goal is to identify how this is going to impact the individual's daily life. Are they going to be able to work? Are they going to be able to maintain relationships? Are they having trouble getting out of bed? All those kinds of things. And we try to help them maintain the best relationships and emotional regulation that they can.